My name is Jessica Bermudez, and today I will be presenting on diabetes in low-income middle-aged adults of Miami-Dade County. Today we will be discussing some topics such as what is diabetes, the risk factors of diabetes, the prevalence of it in the US and Miami, why I chose the target population in my title, some objectives towards communicating with them, challenges to that, communication channels, my key prevention message, the tone I will consider in my communication, and creative considerations. So in general, diabetes mellitus is a condition when blood glucose content is too high. When we eat food, glucose enters our bloodstream, and the job of insulin is to make sure the glucose enters our cells so that they can do the necessary functions to keep us alive. So diabetes is a disease that affects that process. There are three main types of diabetes: type 1, type 2, and gestational diabetes. In type 1 diabetes, the body's immune system specifically targets beta cells in the pancreas that produce insulin. Over time, because these cells are being targeted by the body, they become completely destroyed, and the pancreas isn't able to produce any more insulin. So the body cannot convert blood glucose into energy. The glucose instead remains in the blood. So type 1 diabetes is also known as insulin-dependent diabetes because people with this type of diabetes need to take insulin in order to live. So common methods of delivering insulin to the body is through the standard injection method or an insulin pump. There is currently no cure for type 1 diabetes, and there's continuous research into how to better deliver insulin to folks. One of these is research on some type of patch that will read blood glucose levels in the bodies, but that's of course in development. Type 2 diabetes is a little bit more nuanced than type 1. It begins when the body does not use insulin effectively to transport blood glucose to the cells. The cells of the body signal the brain that they need this energy, so your body starts to overproduce insulin. Now, sometimes this works too well, and blood glucose is depleted completely. So this causes those high and lows that we will see in people that we suspect have diabetes, and causes symptoms that we will be discussing in the next slide. So eventually, the body builds a resistance to the overproduction of insulin, and the pancreas loses its ability to produce these high amounts, and it becomes damaged. So in these cases, people with type 2 diabetes will need to take insulin to account for that damage. Type 2 diabetes was formerly known as adult onset diabetes because it was rare to find in children. However, recent trends have identified more and more younger people being diagnosed with the disease. Finally, gestational diabetes, also known as GDM, is a type of diabetes that affects pregnant women. To be called gestational diabetes, a woman must not have had diabetes before her pregnancy. With this type of diabetes, a woman's body either cannot produce additional insulin needed during the pregnancy, or the woman's body becomes resistant to insulin being produced. Either case is dangerous for both the woman and the child. Fortunately, gestational diabetes tends to resolve on its own, and blood glucose levels return to normal after the woman delivers a baby. However, afterwards, both the mother and the baby are at greater risk of developing type 2 diabetes later on in their lives. So diagnosis and symptoms. Diabetes is diagnosed by using one of the following tests: a fasting glucose test, an oral glucose tolerance test, or an A1C test. The fasting glucose test is done after the person has not had anything to eat or drink for a minimum of 8 hours before getting tested. The oral glucose tolerance test, for this type of test, a person's initial blood glucose levels are measured, and then they're given a large amount of a sweet drink containing glucose. After they have this drink, the person's blood glucose is measured again. And finally, the A1C test, which is known to be the most accurate and the most convenient for people because it measures the level of hemoglobin A1C in the blood, and it can measure the person's average levels of blood glucose over the past 3 months. And it doesn't require the individual to fast or stop eating before the test. Of course, getting these tests completed is completely dependent on whether you can access a doctor to conduct the test for you. Oftentimes, people in the middle-aged level and in a lower income level will have clear symptoms, but because of their insurance status, their financial status, or other confounding factors, they can't get a diagnosis. So some symptoms that people will notice in close family members or friends are frequent urination, increased thirst, increased hunger, fatigue. More severe symptoms include problems with sensation, especially in their arms and fingers and their legs and feet, and vision loss or blurry vision. So some risk factors of diabetes. There are various types. Biological ones include family history of diabetes, being overweight or obese, having other types of comorbidities like high cholesterol and high blood pressure, and also your race and ethnicity. Non-Black Hispanic people and Hispanic people tend to be more prone to diabetes, both type 1 and type 2. Environmental factors of diabetes include the safety of your surrounding areas. This is related to physical exercise. So if a person does not feel safe exercising in their areas, that's more likely to lead to low physical activity, and the person will not be exercising and cannot use their environment. Education level and income level, and a diet high in sugar and fats. Some behavioral factors for diabetes include your social status or your social group. So people with a sibling, a very close friend with diabetes, they are more likely to develop prediabetes or diabetes because of that proximity and because of the shared behaviors. Other behaviors such as smoking and heavy alcohol consumption can also contribute to the development of diabetes. So diabetes does not affect all populations equally. Data from the 2020 National Diabetes Statistics Report by the CDC indicates that American Indians / Alaska Natives have the highest rates of adults with diabetes, followed by non-Hispanic Black people and Hispanic people in third place. At the same time, people with less than a high school education are the most likely to have a diabetes diagnosis. This national data report alludes to a relationship between education, race, and ethnicity, and financial status with diabetes. But this is a lot more noticeable in data in Miami-Dade. So in Miami-Dade County, according to a surveillance report conducted, 11.3% of individuals with an annual income of less than $25,000 were diagnosed with diabetes in 2016. This was the highest rate between the range of incomes examined. At the same time, the same report showed that 13.6% of individuals with diabetes were middle-aged. This rate increased from the 2013 version of the report, where middle-aged people only came in at 8.8%. So if there are no interventions planned, there's a high likelihood that these rates will only continue to increase. So why address diabetes in this population of middle-aged, low-income people in Miami-Dade County? Because 42.5% of hospitalizations due to diabetes were paid through Medicaid in Miami-Dade County. Medicaid is funded by state and federal taxes. So by making people healthier, we also decrease the spending on not just diabetes, but also the comorbidities of diabetes, like heart disease and kidney disease. And those funds can be allocated to other areas. Also, addressing diabetes in adults is so important because this is the population that is raising children or grandchildren. Children mimic the behaviors and the lifestyles of their parents and the people around them. So if adults can adapt a healthier lifestyle, their children will follow suit. So my objectives to programming that will accomplish a decrease in diabetes in this population. I aim to produce culturally sensitive material, so material that is relevant and sensitive to the cultures in these communities. So that means using properly translated reading material, broadcasting in multiple languages, and also using people in my team that coincide with the demographic of the people in this population. So in Miami-Dade County specifically, there's a large population of Hispanic and Black people. So I would want my team to match and possibly be from these kind of areas to build that relationship. Second, it's important to address both people who may suspect that they have diabetes but don't know where to get information, and also people who have diabetes and are trying to balance the difficulties between being low income, caring for a family, and other difficulties that they deal with. Third, I aim to increase the number of people who are properly tested and diagnosed with diabetes. And finally, I plan to share information with this population that will lead to changes in policy that make it easier and not more difficult for them to achieve healthier outcomes. An example of this is advocating to expand the number of places that accept SNAP or WIC funding, or to advocate for clean and safe public exercise spaces. So some challenges to achieving my objectives with this population include overcoming economic barriers and low time commitment. Many adults in this age group work multiple jobs just to pay for bills or rent, or they may be preoccupied caring for children or older relatives. My communication with them has to be convenient and not costly to them because they already face enough hardship. Another challenge is addressing the lack of quality healthcare. In 2010, the U.S. Census report reported that 20% of the population in Miami-Dade did not have any type of health insurance. And lastly, limited access to healthy foods is a major challenge. In low-income neighborhoods, there are no Whole Foods or fresh markets. And even if there was, this population probably could not afford to shop there, or they just simply don't have access to transportation to get there. And so making healthy foods available and affordable to them is a challenge. To communicate with my population, I feel as though the radio is a big resource. Most people in this population already tune into the radio on their way to and from work, and it can reach people who both drive or who use public transportation. So my plan is to access radio channels that this population already listens to and have a guest speaker series or like a special program to develop my message and have it progress over time. I'd also tap into Spanish and Creole radio stations to reach these audiences as well. Another communication channel is having community leaders push this message through. This population specifically, is most likely accustomed to having outsiders and people who they are not familiar with trying to push a message across. So promoting diabetes intervention and prevention may be more well received if it comes from people they already trust. So getting these community leaders on board will help the message stick and likely influence change. So my key prevention message is that there are so many areas of their lives that are already a priority. Taking care of your diabetes will allow you to get to those priorities much easier. With some changes in your lifestyle, you can improve your own future and the future of those around you. So the tone I would like to use is empathetic, empowering, and educational. Empathetic because this population has unique struggles, not only when addressing diabetes, but when addressing many things in their lives. And public health programming or any kind of programming may not always understand that, and it's very easy for them to be felt left out. So empathy is a very useful tool. Empowering is necessary because it gives them the tools to take charge of their own lives and to work together as a community and to influence change. And finally, educational, because if they have a good background and foundation about the basics of diabetes and how to prevent it and how to manage it and how to keep the symptoms at bay, they're more likely to be successful in their personal lives. So finally, some creative considerations about my messaging. Something very important is that all material, whether it's oral, written, or digital, is communicated in Spanish, English, and Creole to reach a wide range of audiences. Eventually, as the programming developed, I would like to include more accessible formats for people with disabilities. So, larger text, or having a sign language interpreter, or anything that would allow me to reach this population as well. And finally, adjusting to feedback from my community is very important, because if something is not working and they are speaking out, then it's important for me to change that, whether it's maybe making the communication more simple or adjusting the hours. But receiving feedback, asking for feedback, and adjusting to that is very important for my communication. And finally, these are my references. Thank you for listening.